Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself. I'm the Executive Vice President, Chief Medical Officer of the CLL Society. And we've all been interested in what's been going on with COVID-19 and how well the vaccines will work in people that are immunocompromised with CLL. And Dr. Larry Saltzman has been doing some research in his position with LLS. Larry, can you introduce yourself, please?
Sure, I'm Dr. Larry Saltzman, also a CLL patient and a board-certified family physician. I'm the Executive Research Director for the Leukemia and Lymphoma Society, and my role has been to build a patient registry, which we have done, to look for patterns of care in blood cancer patients. And our first analysis has been with regard to COVID and the response to vaccines in blood cancer patients.
And this you did with an organization called Citizen. Can you tell us a little bit, just kind of an overview of how this is set up, and if patients are still interested, can they still get involved?
Sure. So LLS is not a technology company. We're an advocacy company. And to do what we have set out to do, we needed a technology partner. We have retained a company called Citizen, which is spelled with two I's, CIITIZEN. They're a technology company that is in the business of retrieving medical records as consented by participants such as us to look at their records. They obtain the records, they de-identify the records, meaning they strip the records of their names, dates of birth, social security numbers, zip codes, any identifying data. And then we're able to look at the records for trends of outcomes. And we have been in contract with Citizen for a little over, not quite a year now. We launched the project with them on a pilot basis last November. We launched the full project in February and the COVID project in March. We now have just under 11,000 people who have consented to sign up for this project. We are still enrolling for the registry and for the COVID surveillance, if you will, response to the vaccine. So come one, come all, we're open.
Yeah, I'm happy to be one of those 11,000. I think I was even one of the beta testers, and on our website we have links to it. And if you go to lls.org, they'll have a link for you too if you wanted to sign up for the registry. It's pretty painless, and you're helping science move forward. So as part of this, I know I've had blood drawn numerous times to look at my response to the antibodies, and you've published some research on that. And I wonder if you can tell us what's published, and if you can tell us if there's any updates. I know that there's been a second paper on the booster. So maybe let's just talk with the first two shots and then talk about the third vaccine. I'm not supposed to call it a booster. I'm supposed to call it a third shot. Yes.
Yes. So we did publish our initial analysis of a little over 1,400 patients in a journal called Cancer Cell about a month ago, actually, a little over a month ago. And we looked at the response to the initial two COVID vaccines, if it was an mRNA vaccine, or one shot if it was Johnson & Johnson. And what we found is that we all need to be careful in that many patients, depending on the type of blood cancer, depending on the treatments that are being administered, did or did not respond to the vaccine. And with CLL, of interest was that, yes, many of the therapies, including anti-CD20 therapies, which seem to be the worst, if you will, for a response to the vaccine.
And that would be rituximab and obinutuzumab, Gazyva, right?
Yes, those were the worst. BTK inhibitors came in second place. But what was interesting to us is that about 25% of CLL patients who are on no treatment at all, call it wait and watch, did not respond to the vaccine. Now, I guess the flip side, the good news is 75% of people who were on wait and watch did respond, but there was a subset of people who didn't respond, and we think it's primarily due to the disease and the fact that the B lymphocytes are affected and not as productive and responsive as they can be. And so we wanted everybody to be careful. And it goes, Brian, I mean, we can go through the grid, but having said it, in the best case, people with smoldering myeloma, 100% of those people responded to the vaccine, right? And then it kind of goes down from there. I think CLL was in the bottom third, I'm sorry to say, of responses, again, basically tied to treatments. But it makes us all take pause. And the mantra of LLS, if you will, is get vaccinated. And we say that because we looked at side effect profiles initially of 3,000 patients who were vaccinated to look at their side effect profiles as compared to the vaccine trials. And they were no worse than the vaccine trials. And actually in heme patients, they seemed to be even a little better. Less people had significant problems. So our mantra is get vaccinated and yet act unvaccinated. We're still saying that. And then we did.
And just before you get to that, I'm just
yes.
saying finally the CDC is finally caught up in August. They finally caught up with us in saying that immunocompromised patients need to continue to take precautions. So it was nice to get some official governance backing to what you've been saying, what the CLL Society has been saying, Lymphoma Research Foundation has been saying, a lot of people have been saying, and that finally the CDC caught up with us and said that also. Yeah.
And not only did they catch up with us on that, but they also caught up on the fact that immunocompromised individuals of any ilk really could or might benefit from a third dose, which is what we've now reported on. So let's talk about that if you want. And what LLS did was follow patients who had their third dose, AKA boosters, really before the CDC came out officially and said we all should do that. And we were able to do this because people in our study, the participants, are very proactive, and some people were writing us to say, you know what, we didn't have a response. We went out and we had a third dose of one type or another. We want you to know about it. And so that allowed us, prior to the big announcement by the CDC on August 15th, that they already were having boosters and we followed them. And so we reported on 49 patients, a majority of whom were CLL patients, who had a third dose and how their responses came out. So I'm happy to share that with you now. If you'd like, I can put up some screenshots, and is that good? I mean, should we do that?
That would be great. Yeah, thank you.
So let me share my screen and let me put this up for you. Okay, so this is just a title slide just to get us centered, and I'm assuming, Brian, you can see this and we're recording it. Okay, perfect. So here is the first part of really good news, which is that of the 49 people we studied, 55% of those people made detectable spike antibodies who had none after their first 2 doses, if you will, of mRNA vaccine. So this is good because it showed more than 50% of people responded. Having said that, we have to talk about both sides of the coin, and 45% of people remained seronegative. And what I'll put up now are some graphics about the therapies that seem to have blocked this seroconversion, including the anti-CD20 treatments, as Brian, as you said, rituximab and obinutuzumab, and some BTK inhibitors may impair the response. So let me put that up. And here then is the kind of bad news, I guess you'd say. So these are the patients who had been on anti-CD20 therapies. And you can see it's a 2/3, 1/3 grid. 2/3 of people on these therapies remained seronegative.
And one of the things that strikes me here is 2 years.
2 years.
Well, yes. And so we're trying to catch up with people, and we were polling them about if they've been on these therapies, in the last 4 months, let's say. And this is holding with some other research that says these therapies really don't wear off for 6 to 12 months. Rituximab probably wears off by 12 months, but obinutuzumab may be longer acting. And anecdotally, as we've been watching now, thousands of people get their second or third shots based on their first one. We're seeing that trend to hold true. So this is a bit troubling, right? And then on the better side of things, let's put this up for people who are on BTK inhibitors. And what we see is the flip side of the 1/3, 2/3, that people who are on BTK inhibitors, 2/3 of them did appear to respond to the third vaccine, AKA booster. And so this is good for those people who need to be on this oral therapy ongoing and who elect to get a third dose. So this is, this is good. And then the last dive into the weeds, Brian, that I'll show you, which is a little hard to see on this, is I put up a table. This is a table of, let's call it, 29 patients with CLL who were part of these 49 that we studied. So your society is really helping us with this. And we have an overabundance of CLL patients who are helping us. They're very interested in being what we call citizen scientists. If you look at the top grid, the rows are separated by a bluish color, if you will. There are a number of patients who had no response to their first vaccines, and they then continued to have absolutely no response to their booster shots. And these patients, there's only one person, and we don't know, why this happened, who wasn't on any therapy. Okay, and it still didn't respond. We think this is still part of the disease, a little bit depressing. The other group of this primarily were on anti-CD20 therapies. And you can see 2 of them in combination with BTK inhibitors and venetoclax. So in those cases, there was no response. And you can see under the column that we have a column of the date of their last treatment. So we've been in touch with these folks to ask them how recently they have been treated. And you can see a couple of them, like row 8, is fairly recent treatment, as is row 9 in our grid. The next big group are patients who essentially started out without a response. You can see they're all less than 0.4 according to the LabCorp Roche test. And then these folks all had a response. Some of them, albeit very small, you can see the first grouping, their numbers went up. The first individual was a number of 2. So that means there was a response, but certainly not a normal healthy adult response that we hope is in the greater than 200 range, right? So you can see that a number of these people did respond. I mean, if you look at this middle grouping, they all started out with no response. And, a small group of them actually got above 200. That's very good. Of those group, one of them was on an anti-CD20, which again, we have to study this. We have to look at their case, their medical records, their genetics. We haven't cracked all this yet to see why this is happening. But, it's fairly optimistic, if you will, correct? And then you see the third group under the third blue line, I guess the third row, are people who started out with a response, albeit low, right? They started out with a number of 16, let's say, and only 2 of them were above 200. But you can see with their third vaccine, they all had a really good response. So again, if you start with something, albeit low, the third vaccine really seems to give a good boost, if we're going to use that word. And these people essentially become in the healthy range. So again, from all this, we are looking at the data. We hope in the next month or 6 weeks to compile data. We have 1,000 or more people who have had boosters and who have gone to the lab already to get their laboratory data. So we're going to be putting that all together and we're going to report on this. So this is the tip of the iceberg data. And I will stop sharing my screen now. And we can talk about that if you'd like. We LLS posted a press release. We will be sending this out on Wednesday to all 11,000 participants of our registry project. So one of the goals of our project is to keep in touch with everybody who are participating. We're not hiding anything. And this will go out in an email blast this coming Wednesday, actually.
Cool. I can't wait to receive that. I'll be one of the recipients.
Yes, you will.
Yeah. Tell me a little about your T-cell research, because isn't that part of this trial too?
Yes. So we are involved in looking at T-cell responses. It's a slower process. It's a 6 to 8 week percolating in the laboratory. We now know, we've confirmed that we have 550 samples percolating in the lab. We have seen responses of the first 27, and I can't that many of the people who did not have antibody responses do seem to have a small T-cell response. This is going to be, I think, a good thing, but not everybody. So we're waiting to get the results. We hope to have, can you hear me okay? I'm sorry, it says my internet connection is unstable.
You froze for a second, but we're good again, yeah.
Okay, we are hoping to have these results compiled in the next 4 to 6 weeks and then reported on. Now, all the T cells that we're looking at were prior to third doses. And once we see the trends on this, and now that you can see, I've reported that there are people responding to a third dose, we're going to be looking critically at those who did or didn't make T cells after their initial vaccines, and those maybe who we want to study now after the boosters. So this is an ongoing project as well. And it just takes a little longer to get this data out. They are not commercial tests. We will not be able to report these results back to individuals, but just like I put up the pie charts and the little tables, we will be able to report trends of who's on what treatments, and we will be critically looking at medical records because we don't want to lead anybody in the wrong direction of where they might be at with this study.
I'm so grateful as a CLL patient for this research. It's so important, and it fits. It's consistent with research coming out of Israel and research that's been done in the US and the UK, other places, and we're finding that our responses to the vaccines are not as robust, though some of us do have good responses. And I think your advice, get vaccinated, but act as if you're not vaccinated, is a maxim that we should all be living by, at least for the present time. Any final thoughts or messages that you want to get across to your fellow CLL patients out there, Larry?
You know, Brian, I just want to, two things. One is I do want to urge caution. And no matter what your vaccine status is or your blood test through us or your doctors are, we don't really yet understand what this all means. And so I just want to encourage everybody to stay guarded and stay safe. And the second thing is to thank you all for your participation in this research, either through LLS or through other studies. We are better off with trials and clinical studies that can help guide us. So we want to thank you from LLS to your society for your support.
Well, thank you, Larry, for all you're doing, and I value your research and I value your friendship. Thanks so much.
Okay, Brian, you take care. Thank you.
You too.